Kansas City area health system losing more than a dozen workers in less than a month. KQ2's Madeline McLean shares what their colleagues are saying drove them out of the KU health system.
15 respiratory therapists have left the University of Kansas health system in the past few weeks, citing exhaustion and frustration.
A lot of the healthcare community is feeling the burnout and feeling the pressure because people don't think it's real, and it is very real.
It's about 10% of the system's respiratory workforce. One of the therapists, Julie Rojas, says it's affecting all corners of the hospital during a news briefing Tuesday.
There's some weeks that I'm here at the hospital more than I'm at home, and your coworkers become like your family, and they understand the things that you see and deal with, and so it's hard for us to lose them.
However, respiratory therapists aren't the only ones feeling that burnout. According to the American Hospital Association, about 30% of healthcare workers across the country are considering leaving their jobs, with 60% reporting impacts to their mental health over the last 18 months.
The work feels heavy, right? I mean, as she mentioned, the house has really been full.
Jace Knudsen is an ICU pharmacist. He says the hope many healthcare workers felt when the vaccine was greenlit is now gone.
Seeing where our vaccination rates are and seeing where our hospitalization rates are and the complications and death that are coming with that, it's really frustrating knowing that a lot of this mortality and morbidity is completely preventable.
And those deaths, Rojas says she carries with her.
Back in the winter, family members couldn't come up, and so it would just be me and a nurse in there, and we would have the family on an iPad, and I would be holding the patient's hand till the very end so that someone was in there with them, and it stays with you.
Rojas says she thinks many in her field are getting out because they are sick of continuing to see so much needless death.
Just to know right now that we could possibly prevent that just from a shot is what really, I think, affects a lot of us emotionally.
Reporting, Madeline McLean, KQ2 News.
Madeline, thank you. Rojas saying during the briefing that KU Health System's vaccine mandate hasn't really affected the people she works with because most of her coworkers support that.